As a thumb rule, there are two important don'ts that we should never forget, irrespective of whatever emergency you are handling. Even though done with a good intent, some wrong actions can cause severe damage to the victim. Rule number 1. Do not move a trauma victim. Trauma is a serious bodily injury caused by an accident or a violent act. If you are not trained in lifting and shifting a victim using recommended methods, you may injure the spine of the victim by lifting them. Such an injury would worsen the situation of the victim and could even cause permanent damage. As a thumb rule, do not move a trauma victim. Do whatever first aid you can without moving the victim. Rule number 2. Do not give any fluid to an unconscious victim. Rushing with water or any liquid is a commonly practiced help offered by people. It is only advisable to do so when the victim is conscious and strictly not when the victim is unconscious. You could end up worsening the situation if you do or allow anyone to do so. Let us understand why. There is a small organ acting like a traffic cop called epiglottis, which directs food and air to the food pipe and windpipe respectively. By design, the epiglottis keeps the windpipe open and the food pipe closed. Only when the food is taken, it opens the food pipe and allows food to pass in. When the victim is unconscious, the epiglottis stops working. So, whatever fluid given to an unconscious victim will only get into the windpipe and the lungs. Lungs cannot support to sustain life with anything other than air filling it. This is equal to drowning a person. As a thumb rule, do not give or allow anyone to give any fluid or food to an unconscious victim. Now that you have learned and on your way to becoming a first responder, here are a few general guiding principles for you to follow. During an emergency, a first responder should take care of his or her own safety as the primary responsibility in first response. Stay calm and reassure the victim. Seek help at the earliest because emergency care is a team effort. Strictly follow the do's and don'ts so that no harm is caused to the victim. Provide essential aid to preserve and protect life. Before providing first aid, you must ask for the consent of the victim. If the victim is below 18 years of age, seek consent from the parent or the guardian. In the best interest of the victim, you can assume consent if the victim is unable to express consent or the victim is unresponsive. Maintain strict confidentiality when it comes to personal details of the victim. Maintain good hygiene to minimize risk of infection. Avoid direct contact with the victim's wounds. Avoid coughing, breathing, or speaking over wounds. Wash hands with soap and water or rinse with an antiseptic lotion. Do not touch the contaminated portion of the gloves or cloth after use. In case you are handling more than one victim, wash hands in between helping multiple victims and change the gloves or the cloth used. You should continue providing aid until someone more qualified than you takes over the care of the victim. Example, doctors or nurses or paramedics. Or another first aid provider takes the charge from you. Or the victim no longer requires first aid. or you are physically incapable of providing first aid any further. We are at the end of the course, and by now you have learnt the following. What is a medical emergency? Who is a Good Samaritan? The Good Samaritan law, chain of survival, checking for vitals and assessing the situation of the victim, basic life support, CPR, common medical emergencies like bleeding, fracture, choking.